Good morning, everyone. Welcome to our journal club review. My name is Sybil Hoyce, and I'm the clinical nurse specialist for the Critical Care Network in Interior Health and the president of BC CACCN. I know it's been a while, but we're excited to bring this discussion forward. The authors review an intervention aimed at nursing students using a storytelling framework and a familiar acronym to support knowledge translation in clinical practice. This article was written by Kristen Sabio, a PhD and MSN, and Nancy Pedges, Doctorate of Education and MSN, and it was published in 2019. Due to the overwhelming amount of clinical content in nurses training, the SBAR method for storytelling was developed as a means to transfer nursing content to the students in kind of an active and engaged manner. The SBAR framework that we all know and love has become a standard framework for healthcare team members to communicate critical information about a patient's condition, creating that culture of safety. Just for a quick review, the components of SBAR communication include S for the situation, so a brief statement of the problem. B is for background, so concise information related to the situation. A is for assessment, where we consider options, and R is for recommendation, so the action requested. SBAR is commonly used during handoff of patient care at change of shift or between members of the interdisciplinary team as a situation needs action. SBAR with the additional R for review is the acronym that these authors used to kind of describe their framework a little. The authors review Kolb's 4 stages of learning in support of their intervention. So first stage is concrete experience. The second is reflective observation. The third is abstract conceptualization. And fourth is active experimentation. So learners construct understanding based on experiences and reflection on those experiences. We know that knowledge can't be gained without the learner making sense of the content using their prior knowledge and experience. Educator storytelling in the classroom can form the basis of concrete experience, and then reflection about that can lead to future application of new knowledge. So the students actually learn from the experiences that you've had if we discuss them together and reflect and talk about application of that knowledge after. And it's that combination of experience and reflection that promotes experiential learning among nursing students. Storytelling can be one of the most effective ways to convey difficult nursing content, preserve experiences, remember, explain, share, emphasize, and learn. More simply, the discussion aids in recall of nursing concepts, in making connections among topics, and in comprehension of larger ideas than lecture would alone. The process the authors went through for this study of this intervention was in 2 parts. There was an exploratory survey from course evaluations, so 125 respondents. The follow-up descriptive study included 39 of those 125 respondents, and these were BSN students at a public Midwestern university, and the authors did say that they had IRB approval. The authors used Bankston thematic content analysis for the qualitative framework for the pilot study. And this is specific to nursing research. They construct themes within written text, and this helps bridge the qualitative and quantitative methods. There was also the descriptive survey with a Likert scale 1 to 5. So not at all effective is 1 and extremely effective was 5. So like every study, there's always some limitations. In this one, it was just a single nursing course at a single school. It was self-report. The number of participants was fairly low. There was no comments about consent from the students or if the students even knew they were part of a study. There was no comments about independent review of results in the article as well. And only a third of those 125 respondents also completed follow-up with the descriptive survey. So only a third of those continued for the second part. So this intervention is actually quite similar to presenting a case study review. However, because it's a shared professional story or personal story, there's more relatedness involved than just a case study. The educator or preceptor is sharing something personal and encouraging critical thinking in the questions they ask. Notice the questions on the right-hand side. They lead to action. What's a priority? What's recommended? The last bit is reflection. Where were the errors and what could have been done differently? These are all questions that we can ask our students to help facilitate that critical thinking and reflection and decide how they're going to apply that knowledge to current practice or future practice. The students claim the intervention helped them. It helped them stay engaged. Some said it made the class interesting and interactive. It brings the urge to learn, some of them said, keeping them motivated. It also helped them retain material, so it gave context and improved recall. They can visualize what's going on, making the material more memorable. They also said that it helped them comprehend concepts, so it aids that understanding instead of just memorizing and cements the process. They also said that it helped relate theory to practice, so it helped them put the textbook into reality. And lastly, it helped them develop critical thinking, which is what we absolutely want to do with our students, because it helped them relate the pathophysiology to the signs and symptoms. So because this study was done in BSN students, is there any use in critical care? Absolutely. I think we already do this to some degree as we talk with students throughout the day at the bedside and do post-conference discussions. This gives opportunity for students and nurses and educators to build rapport, to learn from each other's stories, and provide the safer care to patients and families. I'd say that especially in critical care, the use of storytelling to promote learning is a really valuable knowledge translation tool. Imagine a buddy nurse says to the student, "You need to make sure you grab X, Y, and Z for the procedure we'll do." Now let's reframe that a bit and say the buddy nurse says, "When I learned this skill, I sometimes forgot X, Y, and Z and lost valuable time when I had to leave the room again to get it all." There's a difference in how the two statements might come across. The second statement reframes the same information in a storytelling framework, but it's more relational than the first statement. It seems warmer and less directive. The student learns from your story of forgetting things, that valuable time was lost, and they will be more likely to remember what items should be accounted for than if the student had just heard a list of things to remember before the procedure. It's a really subtle difference, but try it and see what you think. And remember, there's so much value in sharing what you've learned from your mistakes as well. This can be hard for some of us, but those stories are very powerful learning tools, and they also build a sense of connection to the mentors in the practice area, whether those are formal or informal mentors. Also, remember that you don't have to have a formal leadership position to improve the learning environment in your unit. Every interaction provides an opportunity to frame perspectives and create the kind of culture that we want to see in our critical care areas. So some key points to consider are on the screen here. So when we share our story and also the questions that we can ask the student to gauge their understanding of what should be learned from your story. Well, these questions were not in the article. They do show how preceptors and educators and colleagues really can share their stories and what they've learned from them and how students can make meaning of their clinical time. This is also another way to role model the kind of thinking we want to promote in critical care, that reflective thinking. If students hear their mentor colleagues discussing their stories with a sense of inquiry, they're more likely to engage in it themselves. One interaction at a time, our practice environments improve as we change the narrative of the work that we do. So that brings us to the end of the Journal Club presentation for the CACCNBC. If you have any questions about the article or what you've heard here, please get in touch with me. My contact information is at the bottom of the screen here. Thanks for tuning in. And if there's any articles that you are interested in having reviewed, please just send a message to that same email address here on the bottom, and we'll get back to you to discuss it. Thanks, everyone. Take care. Have a good day.